What I think we're really seeing is that addiction kind of across the globe is on the rise. Within the last year, 15% of people reported having a substance use disorder or substance misuse, and about 94% of those people did not receive any treatment for it. If we're thinking about young adults, there's another statistic about 13.5% of Americans over 12 years old actually reported use within the past month, which is about a 4% increase year over year. So I think what we're seeing is that in general, addiction's on the rise, and demand is really high for addiction treatment, but really the supply for addiction treatment is not really there. So there's a need for it, but there's kind of a lack of resources. And even when there are resources, those resources aren't always accessible to everyone equally across the board. Right now, if we're thinking about just New York as an example, and I know that this is happening kind of across everywhere, but a lot of substance use treatment and mental health treatment are very separate from each other. And so while these things can kind of be great on their own, we really are kind of looking, and what would be really beneficial is kind of wraparound care that kind of includes both of these things combined into one. A lot of times substance misuse is sort of like a symptom of another type of mental health struggle or something like that. So yes, you can treat one without the other, but it's not going to be as effective as if you're kind of tackling both at the same time. And when I talk about wraparound care, I mean, you want to have treatment that involves health and wellness, physical activity, mindfulness. You want to be able to have treatment that helps people kind of engage in life outside of substance use. You want to connect people with community. And again, a lot of times when you're in a strictly substance use type of program, they're not always able or don't always have the resources to offer all of those things. Another thing that I would recommend is sort of the need for prevention measures, especially among young people. I think we know that kind of like the DARE programs and like the don't do drugs, it wasn't super effective for a lot of reasons. So with that being said, we really need people to kind of go into schools and really educate students and staff about the risks of substance use and talk about it like in a very blunt way, not as like a scare tactic, but really like an education piece to it. In addition to that, I think staff at schools need to kind of be equipped for managing like a potential overdose or something like that. And really in schools, kind of doing things that you can to reduce some of the risk factors that lead to substance use among young people and kind of increase the protective factors that might help somebody not turn to substances. So again, thinking about community or outside activities, extracurriculars, that's really going to be for the prevention piece of it. In addition, I think there are a shortage of providers who kind of specialize in substance use treatment. And so that can be another really big issue. And that's kind of what I was talking about before in regards to accessibility. Probably one of the things that I kind of see being a barrier is like, because people don't feel necessarily equipped to navigate those things, they may not ask the questions or be as direct or blunt. And so that's really preventing people from being able to talk about it. And also then it's just a total missed opportunity. So number one, being able to train primary care providers on what addiction looks like, and then what resources in the community they may be able to direct someone to. Also, primary care providers just being a little more equipped to prescribe or more knowledgeable about medications that help with substance use. So naltrexone or antabuse or things that can really help people in that realm. Other things that I'm thinking of is just, I know this is talked about kind of a lot, but more harm reduction within the community. And so right now, I think a lot of treatment focuses on getting people to stop using drugs. And while that is obviously a great long-term goal, that's not really where everyone always is. We know that there are kind of 6 stages of change when we're thinking about addiction and substance use and kind of any other behavior. And so we really need treatment that's tailored to each stage of change. So it's kind of impossible if someone's in the contemplation stage, or not even there, the pre-contemplation stage, to get somebody to just stop using drugs. So we really need treatment that's going to meet people where they really are. You know, we talk about these like safe use sites, and I know a lot of people kind of think that encourages substance use, but really, like, if we kind of reframe that and look at it as more of somebody taking a step towards self-love, somebody who's saying, like, this is like a problem that I have, and I want to do this in a safe way. That's actually kind of a good sign, and somebody who's wanting to take better care of themselves. So I guess reframing the way that we're seeing those kinds of strategies as a society, but also just having more options for people, again, based on where they're at in their journey. And then finally, I guess just more family and peer involvement, whenever that's possible. So more resources for families who have a loved one who are struggling with addiction. I think, similar to what I was saying about primary care providers or other non-specialized providers, I think families also often feel like not equipped to kind of deal with addiction. And so if families like learn how to talk to their loved ones, or again, not shy away from asking questions and being curious, there's a really big opportunity there for family members or peers to be able to support people in their recovery process.